Hi, I'm Dr. Sawcer and here at Contact Dermatology today. We're going to be treating Kathy, my assistant Sarah, Garrett on the camera, and today we're going to be dealing with a nail problem. Kathy's had this problem for a while and it's very interesting because it's actually three problems all rolled into one. I suspect some time ago that she actually probably had an injury, and if you look at Kathy's nail here, you can see that it's very curved. And that kind of a curved nail is usually because of some trauma back here, and there's a little scar, so I suspect that's where she had it. But the nail is also discolored along the top here. So you can see that it's sort of yellow and flaky, and down the end you can see all sorts of flake going on at that point. And that's, I suspect, a fungus. So we've got this unusual curved deformity and we've got fungus getting in, taking advantage of that. And worse still, she actually has a very painful ingrown toenail, this side of the nail, which goes, so fingernail, I know, I keep saying toenail. It's growing into the skin. So as it grows towards the end, it pushes in, that's very sharp and it becomes super painful, and it was infected just a week ago when we gave her some antibiotics. So this whole problem is a sort of combination of things that we have to deal with. And for each individual problem has its own individual treatments. And we could do different things for either one of them, but one treatment that covers them all pretty well for most of them and reasonably well for the others is to actually remove the nail. So if we remove the nail, my hope is that the curvature of the nail when it grows back will be less, so it will be better. She'll be able to treat topically as the nail grows back with the antifungal, so that will kill the fungus. And it is a reasonable treatment for an ingrown fingernail, so I hope that when it grows back that won't be the case. So we're hoping to fix all three birds, kill all three birds with one stone. We've actually done a little bit of the anesthetic already. I'm just going to touch that up. I need you to tell me if this is at all painful. No?
It's good.
Yeah. It is the most difficult part of this whole procedure, is to have these injections. There are many ways to do the anesthesia. Sometimes we do a block up here, we do a digital block to block the nerve that leads down to the finger, and there are pros and cons of each. I kind of like this way because I think it leads to less bleeding when we do the surgery, to have the anesthetic down at this end as well. So we'll give that a moment to work while I just change my gloves, some sterile gloves. Yeah, can I have another glove to use the tourniquet, please? So I actually used one of these other gloves as a tourniquet for it. It's something that I guess I learned in England and haven't given up in spite of having other choices. It's easy and it works. There you go. So now you have a nice tourniquet on your finger. So are you sure you want to watch this? Because it's kind of gruesome.
I'll see how
you
much
might
I
want
can
to look
watch.
away. So the first part is to actually try and separate the nail plate from the nail bed, and this is an elevator that I'm using to go underneath it. Are you okay?
I'm okay.
I know it's the idea of it is a little disconcerting.
It's like a scary movie I'm watching through my fingers.
It is, or some sort of awful torture. How are you doing?
Good.
Still okay? So that's gone all the way to the bottom, and then I just flick the corner out. So that corner there is the innermost part of your nail. So that's the side of the nail. That looks good, so that wasn't ingrown. There wasn't anything down the edge here. So now I'm going to go over to the other side and try and get this dug in bit out, which will be a bit more difficult. You still okay?
I'm okay.
Okay, that's just about got that side. So now I'm going to take that out. Oh, almost got away. And there it is. So that's the whole nail removed there. This was the ingrown part. And it's that little dagger bit there that causes all the trouble. So that piece, as it moves down the nail, will dig into the end. And it's always somewhere along the side of the ingrown part. If you want to put it next to something that people can recognize, then you'll get an idea of how big it is, what it looks like. Now, so the bed of someone's fingernail is always that colour. And this stuff here is fungus. So I'm going to actually spend a little bit of time getting rid of that too, just so that it doesn't have too many places to hide as it regrows. Could you stick the visor on me for a sec, Sarah? Thanks. There's another bit of the ingrown fingernail that just came out. How are you doing?
Good. Kind of grossed out.
Oops, sorry. Just trying to clean all the loose debris out of the nail. Anything that looks like it might be there's a bit of nail plate in there too. That's it there. So that is another piece of nail plate that was digging into your finger, causing the pain. Yeah, looking pretty good. Should get a bit more of this off. Okay, so now if we took that tourniquet off, obviously this would bleed a lot more than it has for this procedure, and that's why it's so nice to have it on. I can see exactly where everything is and which bits need to be taken away and which bits are part of the normal nail bed. And if anyone's wondering, this is that there is your half moon. Oops. So right there, that's the half moon that you see underneath the fingernail, and that's the place where your nail grows from. And that, as you can see, is completely intact. So now we're going to put a dressing on that. I hope when it regrows, the nail will grow flat. She'll be treating this area topically as it does so to try and stop the fungus getting the upper hand. And it'll probably take a few months to grow in completely. As far as being painful, the shots are definitely the worst thing that happened to you during this procedure. When it wears off, it tends to be throbby. Okay. If you put your arm down by your side as you're walking along, then it can be a little throbby. Okay. If you put it up, elevate it a bit, then it will stop. Simple analgesias are the thing that most people need. Normally they don't need anything more than that. And after a few days, that's it. It's back to being okay. It's surprisingly quick to get over the... You would think it would be uncomfortable for weeks, but actually it's just a few days.
And there's no limitation as far as
for the first 24, 48 hours, you should be careful with it. And we'll go over those things in more detail after we stop filming the thing. So that's it. Sarah's going to put a dressing on. You want to quickly put that on? Just show people how that goes. And we'll wrap it up. No, we'll be okay with that. Thanks. And there you go. That's it. Take the tourniquet off. Let the blood back into your finger. So again, this is Dr. Sawcer, and this is Best of Both Worlds. And thanks Sarah, Kathy, Garrett on the camera.
Great, thank you.